Hi, my name is Ayunni and today I would like to present about Developmental Coordination Disorder or known as DCD. Developmental Coordination Disorder (DCD), also known as Dyspraxia, is a condition affecting physical coordination. It causes a child to perform less well than expected in daily activities for their age and appear to move clumsily. In the latest edition of the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorder (DSM-5), Developmental Coordination Disorder is subcategorized as a motor disorder within the broader category of neurodevelopmental disorder. It was previously listed as a learning disorder. Dyspraxia in adults. When it's not used in the context of childhood developmental coordination disorder, the term dyspraxia has a broader meaning. Healthcare providers may also use the term dyspraxia to describe movement difficulties that happen later in life because of damage to your brain, such as from a stroke or brain injury. Providers may refer to this as acquired dyspraxia. What is different between dyspraxia and apraxia? Apraxia is often more severe than dyspraxia. Apraxia means that you completely lose the ability to do something even though you understand the command and have a willingness to perform the movement. Dyspraxia means that you partially lose the ability to do something with accuracy. Apraxia also has several different subtypes, including childhood apraxia to speech, limb kinetic apraxia, the inability to make precise movement with your finger, arm or leg, and constructional apraxia, the inability to draw or copy simple diagrams or to construct simple figure. Who does dyspraxia affect? The first sign of dyspraxia, developmental coordination disorder, begin in childhood during the developmental period. As it's a chronic condition, dyspraxia can persist into adulthood as well. Dyspraxia more commonly affects men and people assigned male at birth than women and people assigned formula at birth. Your child may be more likely to have dyspraxia if they were born prematurely before the 37 week of pregnancy, especially if they were born before the 32 week of pregnancy. They were born with a very low birth weight, less than 4 pounds, and if they have a family history of developmental coordination disorder. How common is dyspraxia? Dyspraxia, developmental coordination disorder, is relatively common. It affects approximately 60% of school-aged children. What is symptom and signs of dyspraxia? Can cause a wide range of issues with coordination and motor skills. While most people with dyspraxia show signs of the condition by the time they start school, some people have mild forms of the condition that are more difficult to detect. Signs of dyspraxia in babies. Delays in reaching expected developmental milestone can be early signs of dyspraxia in babies and toddlers. For example, your child may take longer than expected to roll over, sit, crawl, or walk. You may also notice that your child has difficulty playing with toys that involve good coordination, such as stacking cups, has some difficulty learning to eat with spoon and forks. What signs of dyspraxia in babies and toddlers? Delays in reaching expected developmental milestone can be an early signs of dyspraxia in babies and toddlers. For example, your child may take longer than expected to roll over, sit, crawl or walk. You may also notice that your child has difficulty playing with toys that involve good coordination, such as stacking cups, and has some difficulty learning to eat with spoon and fork. Signs of dyspraxia in older children: difficulty with walking up and down stairs, difficulty with balance, they may bump into objects, fall frequently or seem clumsy, difficulty with sports and activities such as riding a bike, jumping and catching, throwing or kicking a ball. They may avoid participating in activities because of their lacks of coordination, difficulty with writing, drawing or colouring, and using scissors compared to other children their age, difficulty getting dressed, fastening buttons, brushing their teeth and tying shoelaces, restlessness, they may swing or move their arms and legs frequently. Your child may become frustrated when trying to perform these tasks. Children with dyspraxia are also more likely to develop overweight or obesity, since they may be reluctant to exercise due to difficulties and frustration with coordination. What causes dyspraxia? Performing coordinated movement and motor skills is a complex process that involves many different nerves and parts of your brain. Any issues in this process could potentially lead to difficulties with movement and coordination dyspraxia. Researchers are not sure of the exact cause of dyspraxia, but being born preterm before 37 weeks of pregnancy and having a low birth weight put children at higher risk for having dyspraxia. How is dyspraxia diagnosed? Although signs of dyspraxia, developmental coordination disorder, are present from an early stage, they can be easy to miss, as children vary widely in their rate of development. Because of this, a definite diagnosis of DCD doesn't usually happen until a child is 5 years old or older. Dyspraxia should be diagnosed by a team of professionals qualified to examine the specific criteria for the condition, which may include a pediatrician, occupational or physical therapist, child psychologist, and pediatric neurologist. There are no medical tests that can definitely diagnose dyspraxia. Instead, your child team of healthcare providers will ask detailed questions about your child's medical history, development, and symptoms. They will assess your child's growth and fine motor skills, coordination, and balance. They will also assess your child's mental ability to see if it's within the expected range for their age. Healthcare providers we also need to rule out other possible causes of your child's motor difficulties, such as cerebral palsy or muscular dystrophy. For a child to be diagnosed with dyspraxia, developmental coordination disorder, they typically need to meet all of the following criteria. Their motor skills are significantly below the level expected. Their lack of motor skills and coordination affects their daily activities and achievement at school. Symptoms of dyspraxia first develop during an early stage of their development, and their difficulty with motor skills is not better explained by other medical conditions. Management and treatment for dyspraxia. There's no cure for dyspraxia, developmental coordination disorder, but different types therapies such as occupational therapy and physical therapy can help children and adults with dyspraxia improve their motor skills and coordination. As dyspraxia affects everyone differently, your child will benefit most from an individualized treatment plan to manage their physical difficulties and improve their confidence. One of the main types of therapies providers use to help children with dyspraxia is called task-oriented intervention. It involves working with your child to identify specific tasks that cause difficulties and finding ways to overcome them. For example, an occupational therapist can help your child improve difficulties with specific tasks by breaking down the movement into smaller steps. They then teach your child to use this individual movement and practice them regularly. Your child may also benefit from adapting certain tasks to make them easier to perform. For example, adding special grips to pen and pencils can make them easier to hold.